I'm going to sort of talk through actually how, or start to get us thinking about what we can truly do. This pandemic, this epidemic is we can sort it. I have absolutely no doubt in my mind that if we put our efforts together, we could make enormous changes within 1 year. And I think if we wish to, within 5 years, all of this stuff we've been talking about today, we'll be well on our way to sorting out. People's health would be better, and certainly the health and social care system would be salvageable. And just some reflections, I guess, before we start going through this on what I'm seeing in the world at the moment, because we all see our own things, we all see our own realities depending on what we're exposed to. Some of and just the gravitas of what's going on around this stuff. So through my role with diabetes.co.uk, as I mentioned, we're rolling out a type 2 diabetes reversal program and the type 1 program coming soon. That's partnered with two of the world's largest reinsurers. So insurance companies that insure insurance companies. The reason they're interested is they've got life insurance and critical illness policies. And if those policies start paying out on a massive scale, the reinsurers have got to pay out to the insurance companies. They've done their sums and they've looked at this and thought they're going to be bankrupt if they don't do something. So for the first time ever, there's probably a corporate interest in actually improving people's health. If they're interested, I think there's a bit of a duty that we should do something on a local level too, and also maybe feel inspired that actually I think the southwest of England is a bit of the beacon of the country, and the country is the beacon of the world around all this. So we could really be leading the local charge. So yeah, I just want to start us thinking about actually this is possible. This concern we have is, why is everybody getting sicker? Why is everybody getting type 2 diabetes? Why is everybody getting fatty liver disease? Why are so many people getting Alzheimer's disease? It can seem quite overwhelming, and with that, you lose belief in that you can do something. As I think we've heard through today, we've got massive belief that what we do can make a difference. You need that belief because you've got to put some effort in and put some work in. But with that belief, we've then got to start putting things into action and turning the scale of this up. Not just for me, when I was just doing GP one-to-one with the patient, I thought that's good. But actually, how for that same unit of energy could I create a 10-to-1 or 100-to-1 or 1,000-to-1 return for people? So yeah, knowing what is possible. So as I've just covered, what we've talked about today, what each talk has spoken about, what many people have experienced for themselves or know people about, we know that improving people's health is possible. We know that all these things, or many of these things, are preventable, and we also know that even once it happened, they can be massively improved and in some cases, inverted commas, reversed. So one of the key things, and it reflects on, I guess, on today, and it reflects on these creating health events, it reflects on where the health and social care system's trying to go. We are no longer in a system where doctor knows best, passive disease walks into the room, disease gets diagnosed, gets a drug, walks back out again. We're in a system where actually the stuff that we are seeing in the health and social care system, the stuff that people are struggling with, is related to how we live our lives. The fundamental important thing with that is people need to know that. People need educated, people need the knowledge, we need to advertise this, we need to put as much information out there as possible with a really positive spin of hope that people know if they go on this journey, if they put the time in, they can truly make a difference to their health. This, empower ourselves with knowledge, which is what today's partly about. Every single person in this room and every single person working in the health and social care system in Somerset, the southwest, the country, the world, will be interested in improving the health and well-being of the people they interact with. They'll be interested in improving or using their time to have the greatest effect. The challenge is if our knowledge isn't sufficient, then we may be unwittingly not using our energies in the best possible way. Equally, as we've spoken today, and my own personal journey, 6 years ago, I didn't know any of this. I was going to work, I was being person-centered, I was really trying to empower people and support them, getting terrible results and just thinking this is the way it is. By learning, I've learned a lot. we've all learned a lot today, and we've all shared a lot of knowledge. That can make a massive difference, but this learning never, ever, ever stops. Some of what we've spoken about today, we'll know something a bit different in another 5 or 10 years' time. We should never rest and think, okay, this is exactly what we have to do. We don't stop, I don't think, until every single person who could possibly have their health and well-being improved, even just by 0.5%, that we've done that. Collaboration, thinking about people, technology, organizations. Again, one of the ways I look at the world is there are 7.6 billion people on Earth and growing. The only way you can impact on 7.6 billion people is by trying to collaborate between all of those 7.6 billion people. Often reflect the similarly, or sometimes the world can be quite competitive, can't there? There's egos at play, and kind of people are most interested in the thing that they do. And often reflect that the amount of poor health out there, if somebody kind of wants to be driving forward with their thing to fix it, they don't need to worry. We're not at a jumble sale. We don't need to have our arms out with getting that the last cardigan before somebody else does. If we fix this metabolic health problem, there'll be another thing we can put our efforts into. It's an endless thing. So I think the more we can collaborate and the more we can find shared goals, the more we can focus on better communications, better relationships, helping the system adapt, but which can be sluggish due to its nature, but just getting on and doing things. My kind of some of my ventures now, seeing the potential around technology. How do you get to, in Somerset, 500,000 people? China, I think, where they have a clear problem with a massively growing population, a real deficit in healthcare professionals. They're heavily investing in technology because that's the way you can get to lots and lots of people. You combine that with the technology, with empowered people, with health coaching, with community development, with peer support groups, creates an extremely different model to 10-minute appointment with a GP. Supporting the journey, which brilliantly we've spoken a lot about today. Again, from a traditional medical background, we will think of, okay, what's the problem? We need to give this drug. That doesn't take much effort. Have your drug, off you go, job done. And therefore, we haven't necessarily, until the last few years, really been investing in and thinking about how do you support people on their journey. And I love this way of looking at things. So to embark on a behavior change and certainly change habits, you have to believe that it's possible, and you have to believe that you might get to your end goal. Otherwise, it's extremely hard to change habits, because why would you change a habit if you don't think it's going to work? So there's a real onus on us to support people and have genuine, high integrity belief and instill that in people that it's possible. But it doesn't happen like this, as we all know. This is a journey, and this is a real journey. And I always think that nobody knows this journey better than yourself. And our job really is to support people on that, knowing that there's twists and turns, knowing that there's loops, knowing that we're heading in this sort of direction, but there's no right or wrong. One of my fundamental principles, I think I've learned being a GP for the last 15 years, is as soon as you instill this idea of right and wrong and judgment, I think, just speaking to patients, the number of people I think have grown up being judged as good or bad, with behaviours being judged as good or bad, which then reflects on whether or not they are good or bad, is astonishing. And equally, we all see the world in different ways. So the challenge that would then create if we're not careful is we judge somebody else's behaviour on our terms. We impart that as a good or bad behaviour, which imparts onto them they are good or bad, and it sends down this horrible, horrible loop. So the alternative is a person knows their journey better than anyone else. We support that journey through empowering them when we need to, and sometimes just through relationships. We know that this is okay, and there's no such thing as failure. We just continually learn, continually improve, and find out what's helpful and what's unhelpful. And it creates the successes I think that we've heard about today. Finally, taking unrelenting action. Again, actually it sums it up in this phrase: the difference between who you are and who you want to be is what you do. I think the difference between where we are and where we want to be is what we do. The fundamental thing, I think, hopefully from today and some discussions we can have a bit later, is actually if we just get up and do what we believe in, find out what we're passionate about, and Find the thing that gets us up every morning, want to walk out the front door with some energy. If it's linked to this, or if it's linked to anything else, you will see results, because that natural doing will be driven from your internal motivation, like our patients when they need to change, when they need to find the motivation to change behaviours, linking it into what matters to them.